Hello, I'm here to talk to you today about informed consent and how to ensure or greatly increase your chance that you're going to be able to have informed consent during your pregnancy and during your labor. So let's go for the quick and simple answer. What is informed consent? It is the right to make a decision about a procedure or drug or other aspect of your health care after a provider has told you about the good, the bad, and the ugly about your options, and you have had time to research your options as well. It's not expected that you make a decision on the spot. 99% of the time it's not going to be an emergency situation, so you're going to have time to think it over, and we'll go over that again at the very end. I'll give you an acronym and a way to handle these types of discussions with your provider. So what does the American College of Obstetricians and Gynecologists say on this very important topic? They say that informed consent should be looked at as a process rather than just a signature on a form. This process includes a mutual sharing of information over time between the clinician and the patient to facilitate the patient's autonomy in the process of making ongoing choices. What does this mean for your pregnancy and birth? It means that you have 100% say over what goes into your body, what you wear, what position you birth in, whether or not you have an episiotomy, whether or not you eat, well, unless you are having a C-section and you're under operation orders to, no food, no drink for that reason. But other than that, you have 100% say. This is very powerful. A hospital can have all the policies they want, but you have the right to walk during labor, to tell them you need the Pitocin turned down if you're in the middle of an induction. You have the right to decline vaginal exam. You have the first, middle, and last say in what happens. Sounds really great, right? Well, with the right to make these decisions comes the responsibility to do the research needed to make these choices. Your involvement in your pregnancy and birth does not end once you arrive at the doctor's office or the hospital and you sign those wonderful forms for treatment. So, what are some great resources to help you make these choices? I always recommend for first-time moms who want an empowered birth to start with Hinsey Goer's book, The Thinking Woman's Guide to a Better Birth. She looks at the benefits and risks of the most common procedures in hospital births through the eyes of reputable studies. You can also go to forums like the ones I created on Cafe Mom called Informed Births Empowered Women. You can also go to a blog called Birthing Without Fear or Evidence-Based Births, or you can go to Google or Google Scholar to read more articles and studies about births and birthing and birthing procedures. This will help you decide for yourself which procedures you are comfortable with and which ones you aren't. This takes us to the next important step in informed consent. What do you want and what do you need? Do you want to delay cord clamp? Do you want to decline vaginal exams? Do you want a birth on your back? This is why we create a birth plan. From a birth plan, we can know what we want, we can vocalize our needs, and we can see what our birthing philosophy is, so we can find a provider that shares the same views and understands our needs. I just read a tragic story of an on-call doctor who didn't honor a woman's right to informed consent to have a C-section that her primary OB-GYN discussed with her because the baby's abdomen was measuring rather large. I won't go into details, it's rather gruesome, but the on-call doctor performed a surgical vaginal delivery and killed the baby in the process. My heart breaks for that family. They didn't know their rights. They could have talked to the hospital and been released into the care of a provider who would perform a C-section as the primary doctor and the mother had agreed. It doesn't matter how you birth. If you don't want drugs, if you want drugs, if you're having a C-section, if you're planning a VBAC, absolutely doesn't matter. It is so very important that you create a birth plan, and that you have your provider sign a copy for your file, and you carry a signed copy into the hospital with you. This will increase your chance of your needs being honored by an on-call provider. Another way you can help to know your rights and to help you exercise your right to informed consent is to hire a doula. Doulas do not have to be expensive. Student doulas work for a reduced rate for the experience. They oftentimes will work for free even, particularly if you are a teen mom or if you're a mother, soon-to-be mom, and your husband or significant other is deployed and military. There are organizations, doula organizations, that will help you get a free doula to help you advocate for yourself and help you have a safe experience. Oftentimes as well, if you're worried about expense, doulas will often barter with you. If your husband's a mechanic or if you have a skill, you're an amazing gardener or something like that, then the doula can say, well, I need this or that or the other, and you can barter with them, maybe for babysitting. There are different things. So don't think just money is the only thing. They often will barter with you on services. Women who have a doula during labor use less drugs, have a drastically reduced C-section rate, have less postpartum depression, and they have an increased success with breastfeeding. Dr. John Kennel, after conducting a study on the effects of doulas on labor and postpartum, said, if a doula were a drug, it would be unethical to not use it. And that is very, very true. They really, really help people. Lastly, there's an acronym to help you with discussing your options during labor with your provider, or even outside of labor, just during the course of your pregnancy. The acronym is BRAND, B-R-A-N-D. And it stands for, B stands for the benefits of this test, procedure, or intervention. R is what are the risks of this test, procedure, or intervention. A stands for what are the alternatives to this test, procedure, or intervention. N stands for what if I do nothing? Because you got to remember that it's not an either or proposition. You can do something, you cannot do something, or you can do something else entirely. So you have a lot of options, a majority of the time, when it comes to pregnancy and birthing. And lastly, the D stands for make a decision. Based on the information that's gathered and what's discussed on the pros and cons and the option of doing absolutely nothing, waiting it out, you make a decision. I have included additional links on this topic for additional information on this subject if you're interested. As always, please feel free to include any links or resources based on this topic, or ask any questions. Knowledge is power. I hope today's segment has helped you understand what your right to informed consent consists of and ways to exercise that, right? And I hope it helps you have a safe and happy and informed birth.